Now, there are some new guidelines as far as the centre is concerned on how the situation needs to be dealt with at the level of the villages and at the level of districts across the country. Village level surveillance, teleconsultation with community health officers and training in rapid antigen testing are among the several areas of focus in the centre's new standard operating procedures to battle COVID-19 as the pandemic gradually moves to the semi-urban and rural areas of the country. It is important, the standard operating procedures suggest, to ensure that community-based services and primary health infrastructure in these areas are equipped to manage infections. In every village, active surveillance should be done for influenza-like illnesses or severe acute respiratory infections periodically by ASHA with the help of village health, sanitation and nutrition committees. Symptomatic cases can be triaged at the village level by teleconsultation with community health officers, and cases with comorbidity or low oxygen saturation should be sent to higher centres, is what the government has advised.
That's the big cause of concern. I mean, rural India, because not only is there the basic infrastructure not there, the testing facilities, RT-PCR tests are not available. That's the reason why they want to change the strategy to do surveillance through the rapid antigen tests. So that will help in actually isolating and going ahead. Apart from that, of course, a number of steps, teleconsulting, a whole host of measures to try to see that infrastructure which is missing in rural India can be in some way or the other, meet that gap and see that one way or the other these people can get some kind of relief. Apart from, of course, the basic toolkits that are required in terms of fighting COVID, the medicines and various other basic structures, of course, also oxygen. But as I explained earlier, the problem really is that in rural India, you don't have those basic hospitals, you don't have the testing facilities, and you need field hospitals. You need to have the help of your armed forces as well as other district agencies to ensure that one way or the other, they will be able to deal with this crisis if it goes out of proportion.